Students, welcome back. Now we are going to see the intra-articular contribution to glenohumeral motions, that is the arthrokinematics. So full range of glenohumeral joint requires the function of the intra-articular structures in an incongruent surfaces. Here the convex humeral head is substantially larger surface and may have different radius of curvature than the shallow concave fossa. Okay, because of this congruence, the rotations of the joint around its three axes do not occur as a pure spin but changing centers of rotations and shifting contact patterns within the joint. So if you can see here in these two pics, because of incongruency and it has to move in all three axes, what is happening here, the contact surface is the center of the head, the point at which it is contacting the glenoid fossa is going to vary according to the movement. Okay, so now here this is the contact point. Now this is the contact point. So the contact point of the head of the humerus is changing according to the type of movement. Okay, so that is the thing here. And here you have to see here in this thing is, as I told that this is not taking as a pure spin, but it is accompanied by a combined rolling and gliding of the head of the humerus on the glenoid fossa in the direction opposite to the movement. So the gliding and the rolling will take place in the direction opposite to the movement of the shaft of the humerus. For example, if the abduction of the humerus would cause, so this is the abduction of the humerus, would cause some superior rolling of the humeral head on the flattened fossa, and then this large humeral head would soon run out of glenoid surface. That means after doing the superior gliding, what will happen, it will move up towards the glenoid surface. During this motion, it is going to touch or contact with the acromion. So, and from that position, if the head of the humerus glides inferiorly, next after it causes some superior rolling in the initiation of the movement during abduction, and then it causes inferior gliding. So here you can see this inferior gliding is taking place to achieve full range of motion. So that means in the case of abduction, there is a superior rolling in the initial stages, and up to the impact of this greater tubercle to the acromion process, and then it starts inferior gliding. So once this head starts this inferior gliding, what will happen? This shaft of the humerus will move upwards. That means it is reaching. So if there is an increased inferior gliding, it reaches the maximum range of abduction. That means it achieves the full range of abduction. So here this is the inferior gliding. So this is the range of abduction achieved. Okay, these are the things happened during abduction. And in addition to the inferior gliding, required for full abduction, the humeral head may also glide anteriorly or posteriorly. Along with inferior gliding, there is a little magnitude of gliding anteriorly as well as posteriorly. So this can be seen, for instance, that cocking phase of pitching a ball. That means during bowling or anything, if you want to pitch a ball on the ground, results in the posterior glide of the humeral head on the fossa. In the case of acceleration phase, that means if you are throwing a ball and during throwing a ball you are abducting your arm backwards, okay, and you are throwing that ball. So that is called as acceleration phase of the throw, is accompanied by the anterior glide of the head on the fossa. So in that phase what will happen? So if you take this humerus backwards, so there may be an anterior gliding of this humerus is seen in the throwing of a ball, that is called the acceleration phase. Whereas in the pitching of the ball, so the head of the humerus will glide posteriorly. So these are the things happened during the arthrokinematics of the glenohumeral joint. So such kind of functions in the glenohumeral joint is brought about by the functions of the muscle which crosses the glenohumeral joint. So these muscle functions are to move the humerus. First one is to move the humerus, and this provide the muscles which are crossing the glenohumeral joint provide intra-articular gliding, and also maintain the opposition of joint surfaces. So that means these two surfaces should be in contact during the movement. So the last two are necessary for dynamic stability requirements of the glenohumeral joint, which are effectively performed. What are the last two? That is the glenohumeral joint, the muscles which are crossing the glenohumeral joint provides the intra-articular gliding and also maintain opposition of the joint surfaces. These two functions of the muscles which cross the glenohumeral joint are required for the dynamic stability of the glenohumeral joint, which are effectively performed. Okay. In the normal glenohumeral joint, the impact of the humeral head on the acromion or the coracoacromial ligament does not occur. Okay, so only in any structural changes in the glenohumeral joint, in that conditions only the impact of the humeral head on the acromion or the coracoacromial ligament occurs. Okay, this is about the arthrokinematics of the glenohumeral joint. In the next session we are going to see the static stabilization of the dependent arm. Thank you.